This bright purple truck is hard to miss in rural Arkansas, and that's the point. The Arkansas Mobile Opioid Recovery Unit, or ARMOR for short, crisscrosses highways to reach patients who are often without access to care.
We could provide peer recovery support, we could provide a licensed mental health provider, we provide primary care and all kinds of access to resources in one stop.
Dr. Kristen Martin founded ARMOR and also serves as one of its physicians. She staffed the truck's 2 exam rooms with nurse practitioners, peer support specialists, and mental health therapists. Since its launch in February, ARMOR has treated over 500 rural patients.
So much a part of why we wanted to do medicine was to go out there and care for people who really wanted our help.
Arkansas has the 2nd highest opioid prescription rate in the country and ranks in the top 10 states for opioid misuse. But treatment can be hard to come by. 41% of Arkansas's population resides in rural areas, many in medical deserts, where there isn't a hospital within county limits. Kim Anderson lives in the medical desert of Hattieville. Up until now, she has struggled to receive care for her opioid use, depression, and high blood pressure.
There's no public transportation at all. So if you can't walk there and you don't have a way to get there, it's not like someone's going to give you a ride every day.
But after the ARMOR truck started showing up 15 minutes away from her house, Kim started scheduling checkups every 2 weeks.
It's hard when people don't understand where you're coming from, whether it's for drug addiction or anxiety or mental health problems or just not being able to get anywhere, like not being able to get to a doctor or, do lots of things. They get it. They'll help you in any way they can.
I followed the ARMOR truck for a day, where peer recovery support specialist Russell Boyd was on board. Boyd was once incarcerated and struggled with substance use too. He says it was only a few years ago he was in his patient's shoes.
There's already a connection there because I have the lived experience.
One of the patients Boyd is seeing today is John Brooks, who's visiting the mobile unit for the 3rd time.
I come every 2 weeks. Even if everything was fixed on me, I'd still come back every 2 weeks to do a checkup.
He's been sober for a year now, and ARMOR is helping him stay that way.
Being on opiates so many years and doing drugs and drinking can really make you think how life is so short to begin with, why destroy what body you do have.
1 in 4 Arkansans don't have broadband access, so ARMOR schedules follow-up visits on site and sticks to a consistent schedule, often stopping at churches, food pantries, and shelters, places where people already gather.
It takes a little bit of time within any community to build that trust and to build that relationship and to show the community that you're going to show up, that you're there really to help.
This June, ARMOR added a 2nd truck to their fleet that will go to the western and southern parts of the state. Their hope? To eventually reach every corner of Arkansas.
When you come in, nobody knows whether you're here to get a flu shot, whether you're here for diabetes, whether you're having a mental health crisis, or whether you have an addiction to opiates. It's perfectly set up that way so that when you come in, no judgment.